All right, turning to health on, 1 in 8 men will be diagnosed with prostate cancer during his lifetime, and it is the second most common cancer among men, with over 260,000 new cases reported last year. But it doesn't have to be a death sentence. NFL Hall of Famer Shannon Sharpe recently revealed he was diagnosed with prostate cancer in 2016, is now cancer-free, and the key is early detection. And Dr. Robert Princenthal is Director of Prostate Imaging at RadNet, and he's joining us via Zoom. Good morning, doctor. Thank you for being here with us. Really such an important topic.
It is. Thank you so much for showcasing Prostate Cancer Awareness Month. Today's the last day of September, and tomorrow starts Breast Cancer Awareness Month. And men and women have the same risks with their respective tumors. 1 in 8 men and women will be diagnosed with prostate and breast cancer. And then, unfortunately, around 30,000 men and women die each year. Men just have not done as good of a job with screening with PSA as women have with mammograms. So we need to change the perception.
Well, part of it is getting that information out there, Doc, and that's why we have you here. How do you detect prostate cancer early? We always say early detection can save lives. How do you do so?
Well, the first thing is to go to your primary care doctor and get a physical exam and a PSA blood test. PSA blood test is sensitive but not specific. But now, finally, with prostate MRI, we have the ability of visualizing prostate cancer in the same way that mammograms diagnose breast cancer for women. So if the PSA is elevated and there's reasonable risk factors, ask your doctor to order a prostate MR. When we can identify the tumor, we can then do focal directed biopsies and reduce the number of men who can avoid an unnecessary biopsy, and furthermore increase the yield and accuracy of those biopsy studies.
All right, and then so that's how you kind of detect it, but when should men go? You often hear 50, now people are saying 40. When should they go?
Excellent question. The guidelines are 50 and above once a year, but certain risk groups have a higher rate of prostate cancer, including Afro-American men. So those people or with BRCA mutations or other risk factors should get screened at 45.
And signs, you know, some folks may be feeling like they may be dealing with something. What are the signs of if they're having some issues?
Prostate cancer early is like breast cancer early. It's often asymptomatic. Men frequently confuse prostatic enlargement, or BPH, as being associated with cancer, meaning they have to get up and pee frequently at night, but that's not a symptom of cancer. So early on, there are no symptoms. That's why screening with PSA and prostate MR is so important.
And what about treatment options and this new FDA treatment called TULSA? Can you tell us more about that?
Certainly. Well, just the way women have evolved from breast cancer with radical mastectomy to simple lumpectomy, the prior treatment for prostate cancer was taking out the whole gland. The surgery's improved with the robot, but why take out the whole gland if we can cure the cancer with non-invasive means? So we're one of the few sites on the West Coast providing TULSA Pro focal therapy, which is very useful for men with grade group 1, 2, or 3 disease that's gland contained. It's a safe outpatient procedure. It uses high-intensity ultrasound under real-time MR guidance, and we can heat the gland from the inside out. We can spare the vital nerve structures and maintain all the important functions that men are concerned about. The treatment takes about 2 hours, and the outcomes have been outstanding as a treatment option.
Well, we love to hear that when you talk about outstanding. Dr. Robert Princenthal, thank you so much for joining us. A very serious and important topic. Again, he's the Director of Prostate Imaging at RadNet. Again, thank you for joining us. We'll be right back.
Thank you.